we can be treating you for diabetes, maybe in the traditional way, but I'm going to be working to optimize your hormones to be also working against insulin resistance and, glucose control to hopefully get you off some of those medications, insulin, specifically.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Kelly McKenzie of Innova Aesthetics. She is a certified family nurse practitioner and worked in endocrinology and infertility for nearly 10 years before opening her own practice. There, she offers an array of services, including aesthetics and bioidentical hormone therapy to assist patients in helping them feel and look their best. She won the Nationwide Registry's Women of Distinction Award, a patient-nominated award recognizing excellence in bedside manner and patient care. So Kelly, welcome and glad to have you here.
Hi, thank you so much. I really appreciate you reaching out, and I love being here, and I'm happy to help.
Yeah, so let's dive right into it, Kelly. How did you first get interested in medicine?
Oh, that's a really good question. I was not someone who grew up and said, I know that I want to be a nurse. I kind of fell into it. I changed my major a bunch of different times, and I actually went to esthetician school first, but it was kind of when the economy was not great. And I said, okay, well, I'll go to nursing school and maybe get back on the medical side of skin. And then life took me a different way, and I ended up in infertility. Absolutely loved it. So it's kind of been full circle. And now I'm back kind of on the aesthetic side.
Got it. So since you
Yeah.
started aesthetics, how did you, I guess, what happened to make you transition back over to aesthetics from fertility?
So it actually was kind of an unfortunate situation. I absolutely loved what I was doing. I did want to kind of start aesthetics again. So I started something really part-time, but the doctor I worked for actually was injured to the point where we had to close the practice,
Wow.
which was very devastating. I absolutely loved what I did, but I just decided to take a leap and try and make the business successful. And that's exactly, what I did. And, I also have two kiddos, so it was nice to have the flexibility, to own your own business.
Okay. Now, when it comes to the practice that now you've now opened up, I talked about in introduction, you offer aesthetics and
Yeah.
hormone therapy. I do want to dive more into the hormone therapy, but what are some of the
Yeah.
other common treatments that you provide to your clients and your patients?
Sure. So first I just started out, with basic, the neurotoxins, Botox, fillers, and chemical peels. Then I integrated like a teeth whitening, some more, deeper chemical peels, that type of thing. I do also offer the GLP-1 services. And then I guess the hormone therapy, ironically enough, since I was doing hormones for so long, that actually is kind of my newest service that I've been offering more on like the bioidentical front. But I definitely just started out very basic, the Botox and fillers.
Okay. So even though it's your newest service, is the one that you have the most experience in over
Yeah,
your career.
exactly. Exactly.
Okay, so I
Yeah,
want to dive
ironically enough.
so the hormone therapy, I want to dive deeper into this.
Yeah.
What is it and why is it important?
It's so important. It is so not, I guess, well utilized in the way that it could be for, I say women. I am a woman. I love women's health. That's kind of what my jam was for 10 years, right? But it's so important for men as well. And the easiest way to kind of explain it is bioidentical is very different than synthetic hormones. And as we age, and even as we are young, our hormones are always changing. And sometimes we're born and our hormones are completely out of whack. So it makes it impossible for us to lose weight, or for women, they have really heavy periods, they have irregular periods. Diabetes, the list goes on. And it's just as easy as kind of switching where those hormones are into a more optimal level for that individual, rather than it's a little less traditional. You're not treating numbers and you're treating symptoms.
Okay. And then you mentioned that there's a difference between the bioidentical versus the synthetic. So I'm assuming the bioidentical is the one either coming from yourself or somebody else versus one that's made in a lab, or what's the difference between those two?
Sure. So basically, a compounded pharmacy versus one of these, I would say, standard pharmacies and an FDA pharmacy. So I only prescribe bioidenticals, and those only go to compounded pharmacies. And it's as easy as like you think about organic versus non-organic with our food. It's kind of like the least amount of fillers and what our body recognizes as what we make versus a lot of the things, like I said, they put in our food or they put different fillers inside of synthetic medication. So that often can come with a lot of side effects, unfortunately, and some are very, very serious. So I like to really stick to the most clean, optimal medication possible.
Okay. And so for the regular or the average person, when
Mhm.
they're looking at getting some type of hormone therapy done, is it
Mhm.
important for them to understand where that hormone originally came from, whether it's bioidentical or synthetic, or are there like subcategories of bioidentical and subcategories of synthetic? Like, how does that work?
Yeah, so it's very important to understand where your medication is coming from. And, if you go over the counter, unfortunately, all of that is synthetic. If you're prescribed, you go to your regular traditional provider, they prescribe you something, you go pick it up at Walgreens or wherever. Unfortunately, that's going to be synthetic. You'll know if it comes from compounding because you'll have to specifically get it sent there. And a lot of them send it directly to your home. You don't have to do like the runaround. Otherwise, you'll have a conversation with the provider that this is specifically going to a compounded pharmacy.
Okay. And
Yeah.
if it's going to a compounded pharmacy, is it kind of specific to an individual person, or is it kind of like you're looking at like the highest quality? So if I want the highest quality, I just want to make sure it goes to a or coming from a compounded lab or pharmacy.
Yes, so I am very specific about the pharmacy that I do use. It's called Belmar Pharmacy, and they do deliver it directly to your home. And it is very specific, meaning, so compounded is basically made for you. It's not something they can just go pick off the shelf and then send it to you. It's something they have to specifically make based off what the provider had recommended. And each individual I kind of consider like a snowflake because they come in and you're going to tell me, like, hey, this is what I don't like about, life right now. I'm really tired. I'm struggling with sugar cravings. I can't lose weight. I can't sleep. And that is what I am going to treat. Even if all of your labs come back completely normal, I think we've all had or a lot of had a incidents where, I'm just not feeling right. I'm just, this or that with our provider, but they say, well, everything's normal on the lab sheet. So that's kind of different now, in a different way that I treat currently. And I'm going to treat all of those symptoms and I'm going to specifically prescribe at that compounding pharmacy, and they'll specifically make those meds for you in the way that I prescribe it. Does that make
Okay.
sense?
Yeah, got it. Okay.
Yeah.
Now, when it comes to the hormone therapy, I'm curious when it comes to specific ages of your
Yeah.
clients and your patients, is there a specific age when people should really start considering this? Or is it really not age specific at all? Or is it like, hey, when you get to your 30s or your 40s or your 50s, you should really start looking into this? Or can someone in their 20s also take advantage of it?
Yeah, so that is a really good question. My youngest client right now, 21. She came in with severe fatigue, irregular cycles. So it kind of depends on what you have going on individually. Women, I can definitely say for my generation, I'm almost 40. Perimenopause starts a lot earlier than kind of what I feel like our generation was taught. They're always like, oh, 40s, 50s, but it can start mid 30s. And it definitely even did for me. Like sleep was changing. That where you could skip a meal and you lose 5 pounds. You don't have that anymore. And you're definitely fatigued and those type of things. So it's important to consider just how you're feeling in your 30s, 40s, but really any decade of life is really important. But I will say specifically, postmenopausal or going through the change is an extremely important time because estrogens, progesterones, testosterones, those come with a ton of health benefits. Heart disease is the number one thing that women die of in the United States. And a big reason is because we don't have that estrogen, progesterone, testosterone on board. It's kind of as simple as we had it once and we felt great in our 20s. We lost it. We just need to bring it back. So it's very important, especially at that age. But men also go through like an andropause, and they typically say that's around, 40. But My husband is pushing 40. I already have him on testosterone and those things. It's kind of what people always think of when they think of men and hormones as testosterone. But I'm also treating his thyroid because he also has fatigue and some of those things. So I think it's very individual as to what you have going on. But my youngest patient, 21, like I said, and I think my oldest is 79.
Okay. Now,
Yeah.
when it comes to you mentioned for, I mean, men, it's mostly going to be testosterone. For women, it's going to be estrogen. I think it's progesterone, you said, and then testosterone also. So, is it a situation where it's like, hey, I'm getting to be 40 or 50 or 60, I should just take this no matter what? Or is it more of they should at least get it checked and see, hey, do you really need this or not?
Yeah, so you definitely should get checked. It's very important that you start estrogen at a specific time and not too early. Whereas the other ones are a little bit more flexible. And it's very, again, individual to kind of what you have going on, but you don't want to introduce estrogen and certain medications too early. And those are definitely like the heavy hitters for, for women is the estrogen, progesterone, but I can't think of very many patients that I have not actually started on thyroid medication. And this is not Synthroid, this is not levothyroxine. Those more geared towards treating like a T4 rather than your T3. But your T3 is that heavy hitter that's really going to help you with the fatigue, the brain fog, a lot of those things that we all experience as we're getting older. I put almost everybody on thyroid. And another big one is also DHEA, which is like a motherboard of we got to have enough of this so we can trickle down and make all of these hormones. It's an antidepressant, helps with immunity. It actually has anti-cancer properties. So that I also take into consideration for men as well.
Okay. And would you say that there's certain hormones or supplements or anything along those lines where it's like you should just take this in general because it's good for you versus which ones are like, hey, you may or may not need this. Let's look at it first.
Sure. So that's kind of a loaded question too, and why you should get your labs drawn. But it's hard because if you go to your OB-GYN, you go to your primary, we are not trained, in my NP school, you're not trained, unfortunately, about hormones. Like, yes, you're trained that this means that they're in menopause. This means they're in perimenopause. But as far as treating those, we're not really trained that. And it wasn't until I went into infertility, which is all things hormones, that I really, really understood hormones. But when you come to a non-traditional provider, which is typically those who provide the bioidentical therapy, which I now consider myself, you have to get a panel and we have to see you at kind of where you are at in that spectrum. So yes, although estrogen may be a extremely important hormone, we need to check, make sure that you're at a level that you are qualified to take that medication. Um, DHEA. Some people do not need DHEA at all. Oh, did I lose you? Sorry. I got a glitch on my end. Um, some people do not need DHEA because they naturally have a very high DHEA. So there's kind of always this ebb and flow of we don't want to treat this, but we do want to treat this, and it's based off your body specifically.
Okay. And when it comes to the symptoms, I know you talked about some of the symptoms, fatigue, weight gain or weight loss, sleep. What are really I guess the tipping point that people should really start looking and seeing, can hormone therapy help them? Because I feel like, especially as people get older, like I'm getting older as well, and I kind of notice like, hey, some like my body's starting to change a little bit. But I
Yeah.
think a lot of people, and even myself, sometimes I'm like, oh, that's just old age, and kind of accept it. So at what
Yep.
point where it's not just old age, like it's actually something that you can fix, versus this is just old age. What
Yeah.
happens when you get older.
Yeah, yeah, and that it's hard, but really it's like I don't want to feel like this anymore. When you start feeling like this, there are answers for you. But, that may be you're at your age and you're like, oh, am I getting old? But for this other, 22-year-old, she's like, that was her tipping point. It was like, I just don't think that this is normal. Other people are like, I'm very healthy, proactive. I want to be able to, live till I'm 80 and feel great. So I don't know the exact time for everyone. But I will say, there's not anybody really that I can think of that wouldn't benefit from hormone therapy, and that's really at any time in their life. I wish I would have known about some of these hormones, early 30s, even in my 20s, when you're dealing just with I don't know, a lot of anxieties and change of life, and sleep has always been an issue for me. So it's not necessarily, oh, I'm getting old, I probably should start. It's like, I just want to change these factors in my life. And I just, in general, want to feel better and be healthy.
Okay. So you really can't go wrong, which is getting checked and just seeing where your levels are and then if it could help you or not.
Yeah, and a lot of the times it's not even about levels. Like I have to check your levels to see where you're at, make sure that we're safe on all ends, right? Before we're starting anything. But if you come in and you tell me that you're tired, I'm going to treat it, whether your lab is quote unquote normal or not, because it's hard to believe now that, 7 billion people fall into this little lab range. Some people feel really, really good out here. And I have a perfect example of that. One of my very first patients, she's like near and dear to my heart. She came in, she had a full thyroidectomy. So they took out her entire thyroid and they were treating her, kind of riding this wave of where it was going to be good for her, right? So she came in and she said, "Oh my gosh, I finally feel great. I finally have energy." They drew the lab and it was out of range. So unfortunately, they were obligated to then treat that and had to bring her to a lower level where then she felt very foggy, tired, did not feel good, but they're treating the lab range rather than treating how she's feeling. So I'm just kind of like gearing away from that now because who doesn't want to feel better? And she had a crazy history of like also a full hysterectomy. So she needed the estrogen and progesterone. She had fibromyalgia. A lot of people always think like, oh, hormones are going to treat hot flashes and these things. No, it's a huge array of things. So she's actually lost weight. She has energy. Her and her husband had not had intercourse in over 5 years. They had intercourse. And then one of the biggest things was she has fibromyalgia and her joint pain is gone. So it's hard to believe a lot of the times that it's going to treat all of these things, but it's like, remember when you were 20 or 17 and you felt fantastic? Like we can still have those hormones even though we're 40, 50, 60, etc.
Okay. And on the flip side of that, then, where it's you want to just feel better, like you're tired or whatever the issues are. What about on the flip side of that, where it's like, hey, I'm feeling okay, like I don't feel any issues, but I want to maximize how I'm feeling. I want to maximize my quality of life. I want to make sure that as I age, I want to age slower and I
Yeah,
want to feel like I'm in my 20s. Can you do that also? Is it really more
100%.
for just I have this issue, I want to fix it?
Yeah, absolutely. Just a general quality of life. I just had a patient come in. She was like a ray of sunshine. She's like 65, just living life. She's living out of a camper with her husband, traveling everywhere. She's super happy. She didn't even have any major complaints, but she's like, I just want to be healthy. And so she's someone, she's been through menopause. So again, those heavy hitters with estrogen and progesterone, getting those levels back to where they are cardio protective because they're down here. She may not be feeling like they're down here, but it's going to be working against her as far as cholesterol, heart disease, bone disease, Alzheimer's, all of those types of things. So her labs actually came back. She didn't have one red flag on there. And I commended her for that because you don't see that often at 66. But she, in general, just wanted to be healthier. And there's a ton of things that we could still help her with treating her thyroid. And I gave that as an option. If you're not feeling really fatigued, then maybe we don't need to. But her DHEA was very low. So then she's losing out on a lot of like anti cancer immunity properties. Again, like diabetes, insulin regulation, the list goes on and on and on. But also the estrogen and progesterone, she definitely needs those as she's aging, and that's going to optimize not only, her health, but longevity.
Okay. And when it comes to the methods of taking the hormone therapy, I know that there's a couple of different ways.
Yeah.
You can do the pellets, which is you kind of put something under your skin, and that's going to be slow release, is my understanding. You could
Yep.
inject it. I don't know if you could take it orally or anything like that, but like, is there really big differences between how people can take the hormones?
Absolutely. And so when I first got into this, I was like, "Oh, I'm going to do pellets." That was like the big thing, right? Because it definitely is low maintenance. But I've actually geared towards I don't do injections, and I actually prefer almost everything oral versus testosterone is actually a cream. And I'll tell you why. The pellets, although they are extremely convenient, absolutely insert it into the skin and you can't take it out. So I can't kind of play with your levels as need be and make sure you're at that cardioprotective level. Also, if you are to get any sort of side effect, let's say headaches, vaginal bleeding, there's not much you can do because it's in your skin it can be anywhere from 3 months to 9 months. So what I would much rather do is, although you do have to take medication, and take a pill every day, we can optimize or keep your level steady where we want it, rather than kind of riding this wave of, oh, we got our pellets, so we have a ton of hormones and we're kind of slowly releasing. And the same thing happens with an injection. So I much rather kind of keep you at a constant level, as well as if you're not feeling any difference, let's say 3, 4 weeks, um, we can make changes, right away. And also, I want to make sure that some of those heavy hitters, like estrogen, for example, is at a certain level that we know for sure this is when you get cardio protection. I don't want you sitting at a 40 for 9 months with a pellet when I need you, 75 to 100. So, some providers, I think we all treat a little bit differently. I think it's great that people get pellets, don't get me wrong, just to have any sort of hormonal therapy, but my preference is definitely pills, and creams rather than the injections and pellets.
Interesting. Okay. And so,
Yeah.
how do you approach educating your patients and clients on this? Because I mean, we got into a couple questions. I'm sure you get a lot of these questions from your clients, but like, what's your
Yeah.
approach to how do you educate them really on the benefits of this treatment?
Yeah, so there's actually a lovely little handout that I have from the World Link, is actually who trained me, but the provider, he put it all together and it very greatly explains everything. So I give that out free to anybody I can. Gave one to my mailman the other day. But when they ask me like, why should I do this? Or I went to my OB and they didn't really do anything, I have to talk about how it's kind of, yes, untraditional, but unfortunately, if you look back, like the 80s, 90s, early 2000s, hormonal therapy was huge. And then there was this big study that came out 2002, 2003, that said hormones cause cancer. And so we talk about that study and how it actually was very flawed and how it's been proven flawed. It's been disproven many, many times over. And also, absolutely, hormones may be linked to cancer, but they failed to say that that is synthetic hormones. There's not one study to date that shows bioidentical. And we just talk about the difference between that. Again, kind of a lot of fillers versus as natural as you can possibly get. And then as simple as we had it before, we still need it now, and we go through the specific hormones and what it is that they could benefit from and all of the, health problems that they run into without having these hormones that we had previously.
Okay. Now you mentioned that flawed study where people believed it was causing cancer. I'm sure
Yep.
that's a common myth that you hear from some of your clients coming in. But what are some other misconceptions, some other myths that are very common with this type of treatment that you hear?
Hmm. I definitely hear a lot from other providers too, that there's no difference between bioidentical versus synthetic, which I don't disagree with. Cancer is probably the biggest one, especially breast cancer specifically, that they're not readily available. But I mean, actually, like I said, they get delivered directly to your home. Or I think a lot of times people get frustrated, and I'm almost like the end of the road for them because they've talked to their primary, they've talked to their OB, they get put on an antidepressant, and they're just like at their wits' end, like, I don't know, what else to do. So unfortunately, I'm kind of one of their last resorts, and I just wish it would be more, at the forefront. But I think, yes, a misconception about there is a difference. It doesn't cause cancer and it can be readily available.
Now you mentioned that you're almost like the last stop where they've tried everything else and nothing else has worked for them, and then they come to you and then you're able to solve their issue. Do you believe that this should actually be their first stop, or at least in the very, very beginning stages?
Well, I believe that this should be on the forefront of healthcare in general. That the FDA and compounding pharmacies should come together rather than kind of pushing and working against each other. It should absolutely be at the forefront. Every OBGYN, primary care, they should be able to prescribe these things. We should be able to be educated on these things, but let's just say that it's a very business driven healthcare system. And so there's a lot of misconceptions about what is good, what is not good. They have a lot of say in what we do provide, what we don't provide, as far as, medications, or I should say, subscribe, what we can and can't subscribe. So it should be at the forefront of healthcare, but that's why I'm considered now like a non-traditional provider, and I do order the compounding versus the synthetic.
Okay. And do you think that the I mean, I think what like hormone treatment, regenerative medicine, functional medicine is kind of like that alternative medicine section of medicine. But do
Yeah.
you think that kind of what you fall under, do you kind of fall under like the what's considered like big pharma? I mean, it's kind of a drug, but like I don't really see this as like your traditional drug or like, oh, you're suffering from this, this, and this. Take these 10 pills every single day for the rest of your life. Like,
Yeah.
well, I think you feel kind of outside of that, but like, is there really a big difference between those two areas that you see in your viewpoint
Between big pharma and
and
what
the
I'm,
hormone
yeah.
therapy? Yeah.
So I do think that there is a big difference. I don't know that I call myself like functional medicine necessarily, just because there is absolutely a place for medical, needs, other medications, et cetera. I'm all for that. I just think that big pharma and compounding need to come together, create more of a naturalistic and treating the patient rather than the numbers, not be driven by, what medication is making money, that type of thing. Does that
Okay.
answer your question?
Yes, well said. Now, I'm curious, what role do you believe creativity plays in how you approach patient care? You kind of mentioned before that every person is like a snowflake. They're very unique in their situation, but then there's also medicine. I mean, you have a very long experience in medicine. It doesn't seem like most people think that there is room for creativity. It's follow this path, or you're going to kill this person. So, what role do you believe creativity plays in how you approach your
Yeah.
patient care?
Yeah, so I definitely feel, I guess, a little bit more creative in my ability to treat patients because before it was just an algorithm of this is what they have, this is what we should try. If they're allergic to this, then you prescribe this. And it was very traditional, right? So now I love that everyone is a snowflake. I love that everybody I can treat specifically. They also have autonomy, and I don't want to do this. I do want to do this, which is very nice, I think, for them, and why I think it's almost a breath of fresh air because, as simple as I think these patients actually feel heard and they want to talk about their symptoms, they don't want to treat it, they don't want to talk about the numbers. Now, again, on the flip side, I have to do a full panel of labs and make sure that, you don't have something else underlying because if it does come back and let's say you have diabetes, you're in kidney failure, something like that. That is not something that I am going to manage. And there is a place where I'm going to send you back to your traditional provider. However, on the flip side, we can be treating you for diabetes, maybe in the traditional way, but I'm going to be working to optimize your hormones to be also working against insulin resistance and, glucose control to hopefully get you off some of those medications, insulin, specifically. So I think we can work together. I think there's just this big line still of like providers, probably a lot of them think that we are crazy who are doing the bioidenticals and they don't, necessarily believe in the difference, but it's a difference in training. And I will tell you, when I first was like learning all of this, I'm like, I don't know, because it's so stuck in your head and how you have to treat people and you're scared to go out of those lines. But after doing this now for a while and reading about a billion studies and all of the training, I just wish we could be more on board, with each other.
Okay. Now, you did mention as far as it comes down to training, comes down to experience. So
Yeah.
let's say that somebody is looking for this hormone treatment, and they're not sure who to go to. What would be the
Yeah.
most important piece of advice you can give to someone in that situation? Like, what should they look for, and ultimately, who should they end up going with?
I think every single person should ask their provider, well, one, their credentials. You should be being prescribed by either a nurse practitioner or an MD. Nurses are not qualified to be, prescribing that type of thing. Holistic, I don't know if you'd call them, providers. You just want to make sure that they've actually had medical training. You can ask them where they were trained, but I think one of the biggest things is make sure that they are actually prescribing compounded medication, non-synthetic medication, and you should absolutely ask them, well, is it synthetic? Is it compounded? Where are we getting it from? What is the difference? Because there are providers that say that they do hormone therapy, and they might, they probably do. But if they are prescribing all of the synthetic, progesterones and estrogens, a lot of which the UK has completely banned and won't even prescribe over there, but we still do here, you're not getting as much benefit and you're actually possibly putting yourself more at risk. And, where those cancer studies came from, essentially. So sometimes it can be hard to find, but if you have a provider who can't answer those questions, then I'd maybe be a little bit leery.
Okay, good to know. Now, I'm curious, where do you think the future is going with hormone therapy?
I think I think it's coming back. So it's been over 20 years since that study came out. My mom's generation, so she's 66. That's a hard generation. They were like, nope, it causes cancer, not doing that. I think that women my age, though, are becoming more coming around to it. And people are just starting to talk to each other. And now the hormone stuff is taking off because everyone is feeling this way. You
Mm.
know, perimenopause can go on for 10 years. And then menopause isn't that much fun either. And for men too, you know, they're getting diabetes, cardiovascular disease, ED, the list goes on and on. So I'm thinking that it's coming back.
Mhm.
I don't know when it will be more friendly between traditional providers and non-traditional providers. That I can't really foresee, but I will say that it is coming more to the forefront. And I think patients are very well educated these days and are looking for alternative medicine. So there's more and more providers that join each time that I, you know, go to training. So I think it really is, you know, taking off. And I think that's just burnout on providers and too, you know, it's hard to work in a health system where you are managed by this is what you have to prescribe. You only have 15 minutes with a patient. Oh, and you better have gotten everything right during that time. And you better got a 5 out of 5 stars. It's like that's a really tall order.
Yeah.
So I think there's a lot of burnout. And also, like, are we helping the patient or are we just treating like symptoms? You know, I
Mm.
don't want to keep throwing medication at another symptom. So we all got into this because we want to make patients feel better. So hopefully there'll be a turn and we
Okay.
can get back to that.
Okay. And that's why you opened up your practice. So I'm curious, then what is the vision for Innova Aesthetics?
Okay, so it's so funny you say that. I'm actually going to look at a couple different spaces after we are done today because I would really like to just kind of open, I guess, wellness where it's a non-traditional practice. I have other friends that are nurse practitioners that are burnt out, that are very interested in this kind of healing and prescribing. Then I have a friend who's an ultrasonographer, so I'm trying to get her to come on board. I'd love a massage therapist in there, you know, just a wellness, a place that you can go feel good from many different aspects. And maybe it is non-traditional, but you're going to have easy access to it. You don't have to deal with the headache of insurance.
Mhm.
But that's kind of the long-term goal. But right now, I just kind of need to get into a bigger space and just have more of a just clinical vibe where I can maybe have two rooms instead of just one. So, but
Got it.
the long term, I love the aesthetics. I can definitely continue to do that, but I think my heart is definitely in the hormone. So I hope that that continues to take off.
Oh, it looks like sounds like it's a bright future ahead.
I hope so. I appreciate that.
Okay, well, Kelly, I have one last question for you, but before I ask it, I do want to point people to your website at innovaaesthetics.com.
Yeah,
Now, the
exactly.
last
Thank you.
question is, yep, the last question is, what does beauty mean to you?
Oh, that's deep. Is it the same to everyone? I don't know. But to me, feeling fulfilled physically and mentally within yourself and whatever that means to you as an individual. I feel more beautiful now than I did when I was 20 with less wrinkles because I feel good. I'm confident, you know, where I'm at in life and physically, mentally, I'm in a good space. So I think that's beautiful in general.
Awesome. Well, there you have it. Kelly sharing her expertise and knowledge. So, Kelly, where can people contact you and your practice?
Sure. So AnovaAesthetics.com is probably the easiest way. Otherwise, the business phone number 815-761-2426. You can contact anytime, text or call. Otherwise, Facebook and Instagram as well.
Awesome. Well, Kelly, thanks for coming on the show. This is amazing. Thanks for sharing your expertise and really talking a lot deeper into hormone treatments.
Yes, thank you so much. I appreciate you. You take care.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.